Rett Syndrome, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Rett Syndrome, Things You Should Know, Questions and Answers. This book will help you understand, revise, and have a good general knowledge and keywords of Rett Syndrome. Section 1. 1. Is Rett Syndrome a rare genetic disorder? Yes, Rett Syndrome is a rare genetic disorder. 2. Is Rett Syndrome a neurodevelopmental disorder? Yes, Rett Syndrome is a neurodevelopmental disorder. 3. Rett Syndrome is also known as cerebroatrophic hyperammonemia. 4. Can Rett Syndrome be inherited? Yes, Rett Syndrome can be inherited. 5. Is Rett Syndrome mostly inherited? No, Rett Syndrome is not mostly inherited. Only a very small percentage of Rett Syndrome cases are inherited. 6. What are the two main types of Rett Syndrome? The two main types of Rett Syndrome are the typical and the atypical Rett Syndrome. 7. What system does Rett Syndrome affect? Rett Syndrome affects the nervous system. 8. What are the two main parts of the nervous system? The two main parts of the nervous system are the central nervous system and the peripheral nervous system. 9. Rett Syndrome usually has how many stages? Rett Syndrome has 4 stages. 10. What are the stages of Rett Syndrome? The stages of Rett Syndrome include Stage 1, the early onset that includes less eye contact, slow motor skills, etc. Stage 2, the rapid destructive stage that includes speech difficulties, hand movement problems, autistic behavior, breathing problems, slow head growth, etc. Stage 3, the plateau stage that includes motor skills difficulties, seizures, etc. And Stage 4, this stage includes scoliosis, walking difficulties, etc. Section 2. 1. What is the cause of Rett Syndrome? Rett Syndrome is mainly caused by mutation in the MECP2 gene. 2. What is mutation? Mutation is a change in DNA sequence. 3. Does the mutation in Rett Syndrome occur randomly? Yes, the mutation in Rett Syndrome occurs randomly. 4. What is the MECP2 gene? The MECP2 gene is methyl-CpG binding protein. 5. Where is the MECP2 gene found? The MECP2 gene is found on the X chromosome. 6. What is a chromosome? A chromosome is a long DNA molecule that contains the genetic material. 7. What are the sex chromosomes? The sex chromosomes are the X and Y chromosomes. 8. What is a gene? A gene is a fragment of DNA. 9. What is the cure for Rett Syndrome? Actually, there is no cure for Rett Syndrome. 10. Can Rett Syndrome be prevented? No, Rett Syndrome cannot be prevented. Section 3. 1. What are the male chromosomes? The male chromosomes are the XY chromosomes. 2. What are the female chromosomes? The female chromosomes are the XX chromosomes. 3. The human body contains how many chromosomes? The human body contains 46 chromosomes. 4. Do babies always show signs of Rett Syndrome in the first few months? No, babies don't always show signs of Rett Syndrome in the first few months. 5. At what age do the signs and symptoms of Rett Syndrome appear? The age the signs and symptoms appear of Rett Syndrome varies from one person to another. 6. Does Rett Syndrome mainly affect boys? No, Rett Syndrome does not mainly affect boys, Rett Syndrome mainly affects girls. 7. Is Rett Syndrome more serious in boys or in girls? Rett Syndrome is more serious in boys. 8. Why is Rett Syndrome more serious in boys compared to girls? Rett syndrome is more serious in boys because boys have only one X chromosome. 9. Why is Rett syndrome less serious in girls compared to boys? Rett syndrome is less serious in girls compared to boys because girls have two X chromosomes. Section 4. 1. Are the signs and symptoms of Rett syndrome the same in individuals? No, the signs and symptoms of Rett syndrome are not the same in individuals. Signs and symptoms vary. 2. What are the signs and symptoms of Rett syndrome? The signs and symptoms of Rett syndrome include slow growth development, walking problems, difficulty in speech, breathing difficulties, teeth grinding, laughing inappropriately, small hands, small feet, muscle spasticity, etc. 3. What is microcephaly? Microcephaly is a small baby head compared to the normal size of a baby's head. 4. What is gait? Gait is a person's manner of walking. 5. What is atrophy? Atrophy is a reduction in size. 6. What is apraxia? Apraxia is a speech disorder. 7. What is apnea? Apnea is a disorder that causes a person to stop breathing, then restart breathing during sleep. 8. What is hyperventilation? Hyperventilation is an abnormally deep and rapid breathing. 9. What is bruxism? Bruxism is grinding of teeth. 10. What is spasticity? Spasticity is muscle stiffness. Section 5. 1. What are the complications of Rett syndrome? The complications of Rett syndrome include epilepsy, cardiac problems, pneumonia, anxiety, eating difficulties, joint problems, etc. 2. What is epilepsy? Epilepsy is a disturbance in the electric activity of the brain. 3. What is pneumonia? Pneumonia is an infection of the lungs. 4. What are alveoli? Alveoli are the air sacs of the lungs. 5. What is hypotonia? Hypotonia is a low muscle tone. 6. What is scoliosis? Scoliosis is a deformity, bending of the spine. 7. Is there regression in motor skills in Rett syndrome? Yes, there is regression in motor skills in Rett syndrome. 8. Is there regression in cognitive skills in Rett syndrome? Yes, there is regression in cognitive skills in Rett syndrome. 9. How is Rett syndrome diagnosed? Rett syndrome can be diagnosed with a blood test. 10. Are there treatments for Rett syndrome? Yes, there are treatments for Rett syndrome. 11. What are the treatments for Rett syndrome? The treatments for Rett syndrome include speech therapy, occupational therapy, physical therapy, scoliosis treatment, medications to treat seizures, etc. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding Rett syndrome.